Hello, this is Mike Lessner, Global Health Talks. We are delighted to have as our guest today a guy who has a very interesting background. So many times we hear of people just sort of starting with a great subset of community talents. And we have in front of us a community pharmacist. At least that's his DNA. But recently, at the sad passing of the past president of the International Pharmaceutical Federation, we now have a new acting president of the organization, and we're coming up on the 81st World Congress of this organization, which is, I think, over 4 million strong in countries around the world. So I'm very anxious to hear what the themes are of the Congress, what all of your unique working energies are with different countries, how the countries differ. So with that, I turn it over to you, Paul Sinclair, and welcome to Global Health Talks, Paul.
Thank you, Mike. It's a pleasure to be with you, and I look forward to our chat today. Yes, it was very sad. The immediate past president of FIP, Dominique Jordan from Switzerland, passed away 10 days ago. I was due to assume the role of president at the end of the Congress in Brisbane, but that has been brought forward, and I'm in the role of acting president until my role is ratified by the FIP Council at the start of the Congress in Brisbane. So it's under quite sad circumstances that I assume that role, but nonetheless, I look forward to the challenge that lies ahead. FIP is an organisation made up of member organisations. We have at the moment more than 150 member organisations from more than 100 countries around the world. They are different in the way they operate, from the very emerging marketplaces and models where pharmacy is very much in its infancy, to the very highly developed marketplaces like North America and Europe. So there is a broad spectrum. We represent pharmaceutical educators by way of academic institution membership, pharmacy regulators, as well as all the practitioners. So it's a broad scope, and there is we advocate for and represent more than 4 million pharmacists in all its disciplines across the globe. There are developing countries in places like Africa where they have the most simple challenges of accessing medicine shortages, logistics in terms of transporting medicine from point A to point B, where it might be from a capital city to a remote village where that population can access the medication. It's a far cry from pharmacy as we know it, but it's pharmacy as it's practiced in those developing countries. Challenges there also include a skilled workforce, having enough pharmacists to deliver pharmaceutical care to the population. It's also around having an education system which delivers the best opportunity for pharmacists to be as qualified as they can be. FIP has a program called UniTwin, which aligns universities in developed countries like North America and the UK with emerging countries and universities which are nowhere near as well resourced. So they are twinned or paired to provide resources and expertise to those universities in poorer countries so that their outcomes educationally can be better than they would normally be. There are challenges everywhere, simply across, whether it be geographically, whether it be population-wise. In India, for instance, pharmacists play a key role in servicing patients with tuberculosis. Now, tuberculosis is a disease which has been eradicated from most of the world, but pharmacists are key players in provision of services, pharmaceutical care services and medicines and delivery of those medicines to patients with tuberculosis.
All right. Well, to get you started off, you want to tell our audience a little bit about your community pharmacist background and how possibly it ideally prepared you for the task ahead. What is the connection between needing the company and running the company, so to speak?
Okay. So I'm a practicing community pharmacist in Sydney. I've owned community pharmacies for most of the last 30 years or so. I grew up in a small country town. My father was a pharmacist, so I grew up very much in a pharmacist environment. I saw the engagement that my dad had as a pharmacist with his local community, his involvement, and also the professional satisfaction that he got out of servicing that local community. So it was a natural progression to some point that I would also be a pharmacist. And I embarked on that journey, and it's been a very satisfying professionally and personally journey for me. I've had the privilege of being involved in a number of organisations along the way, which I think have laid a very solid platform for me to take on the role of president of FIP. I've been involved with the Pharmacy Guild of Australia at a very senior level as National Vice President, which is the organisation which represents owners of pharmacy in Australia. They are the organisation which has a commercial arrangement with the government to provide pharmaceutical benefits to the Australian population. I've been involved with the Pharmacy Council of New South Wales, which is our professional regulator. So I think I had a good grounding in pharmacy. I also had a background in local government and served on the local council as a councillor and as mayor over the course of 10 years. So I've always enjoyed being involved in the local community within my profession. And when the opportunity came to be involved with FIP, I saw a great chance to engage more at a global level and also to understand better the profession across the globe. So I embraced that, and my journey through FIP has seen me progress through the various boards of FIP to today, where I have the opportunity to be president of the organisation. And I consider that to be an enormous privilege and a great challenge.
Assuming they let you in, which I think they're going to do, tell me a little bit about how you see your role and what will be your various functions and in addition to that, what must be your functions in terms of this moment in time for pharmacists and what their unique challenges are?
Okay, so obviously from a governance point of view, I will chair the bureau, which is like the board, and the bureau answers to the council of FIP. That's a major responsibility. We are an organisation made up of member organisations. So I have a responsibility to engage with those organisations to ensure that FIP is delivering against their needs. The value proposition that we have for our membership is complete and is attractive to our membership. We have bureau or board members from across the globe. So it's a major responsibility to engage with them, to bring them along on the journey to make sure that their constituents are represented, they're heard, and they're advocated for in all of their pharmacy forms. I'm a community pharmacist, Mike, but FIP represents pharmacy in all its disciplines. It represents pharmaceutical practice, pharmaceutical science, and pharmaceutical education. So across those three disciplines, we embrace a philosophy of one FIP, which basically means that we can't do anything without a skilled workforce, which is provided by the best available education. We can't do anything without the appropriate medicines and technology, which is provided by the pharmaceutical scientists, and delivering it in a manner which promotes the best outcomes for the patient, which is pharmaceutical practice. So it's
Please go ahead.
It's a big brief, but it's one that over time FIP has delivered consistently for its member organisations.
Okay, so we're coming up on when in September is the Congress? I had it written down.
Starts
September
on the 25th.
24 to 28.
Yes,
okay.
correct.
In Brisbane.
Correct.
And there are themes, general themes, 4 or 5 of them. Can you walk us through what the themes of the conference will be and why they're so vital?
Certainly, Mike. The overarching theme is pharmacy building a sustainable future for healthcare, aligning goals to 2030. That's a reference to the UN Sustainable Goals, which were laid out a number of years ago. FIP has its own development goals, which align with the UN goals. So everything we do is about aligning with the UN Sustainable Goals. In doing that, we have a number of themes for the Congress, from global solutions for global health challenges. That has been highlighted pretty dramatically by the COVID pandemic. Global health systems have been put under enormous pressure. And you mentioned earlier, Mike, that technology saved the medical profession during COVID. Well, in fact, a lot of medical practitioners went to a virtual model, but pharmacists stayed at the front line.
Sure.
Pharmacy stayed open. Pharmacy kept delivering services when other practitioners went to a virtual model. That provided a lot of challenges. Workforce was put under enormous pressure. A lot of pharmacists actually caught COVID. A number of pharmacists died. So it was a difficult time for pharmacy, but it highlighted a lot of future opportunities and a lot of potential for pharmacy. Those global solutions that we will take forward will be learnings from the COVID pandemic. We have the next topic is Together for Better Health Outcomes. That's essentially about how we can collaborate both within our own profession and with other medical providers, other primary health providers. Everyone now talks about interprofessional collaboration, but it is now more important than ever, particularly when we see expansion of scope of practice. You mentioned earlier about provision of medical information to patients. Well, now there is very much and COVID has facilitated this, an expansion of pharmacist scope of practice to vaccination. Pharmacists in the UK, for instance, in 2026 will leave university as independent prescribers. They'll be able to prescribe medication based on a diagnosis process for minor ailments. That is a significant step forward. That will involve collaboration with doctors and nurses. The third topic is innovations in the modern world, creating opportunities for pharmacy. This is essentially around technology and how that will impact the practice of pharmacy. We see that we're in a world of AI, chatbots, and emerging new technologies and medical technologies. These will all become part of the pharmacy landscape, and pharmacy will need to adapt itself, as it has in the past with technologies, to deliver those as part of its daily workforce and deliveries. The fourth topic is targeting special interests. And this is an interesting part of the program, Mike, because we have there is a surgical pharmacy discipline in China, which is peculiar to China and a few other places. But we're having presentations from Chinese delegates on this specialty, and these pharmacists specialise in provision of medication for perioperative patients prior to a procedure, during and after a procedure, to ensure that they achieve the best possible outcome. There are new technologies for special interests. So it caters broadly for all of pharmacy disciplines. We will have regulator forums and we also have a significant program for the pharmacy educators. So, Mike, it will cover recent developments. It will cover technology. It will cover collaboration, and also those interests which may appear to be not a mainstream interest in Australia, but in emerging markets like China, very significant interests such as clinical pharmacy and surgical pharmacy.
How much of the Australian system will be interjected into the conference? Are there any things about the way you guys handle what you do that you think might be apropos to other systems and other countries? And then at that point also, can you discuss a little bit some of the unique advantages to some countries that they're facing, be it economic? Certainly we know that in America, we have this treatment system. We love to spend money, but every place else in the world has a preventive system. They try to keep you from getting sick. And so there's a special onus on pharmacy to kind of get out ahead of things. So I'm interested in and I'm not familiar with Dominique's mantle. I'm sure he was strong and very competent. Are there any things that you see that you're inheriting that possibly you see changing a little bit, or might be different?
Yes, Mike. Firstly, a couple of things there. In the Congress in Brisbane, we will have a special session on pharmacy in Australia, which will showcase our practice of pharmacy, whether it be in hospital, whether it be in industry, or whether it be in community. That's a great opportunity for delegates to see firsthand what happens in Australia. We have various presentations from member organisations, whether they be from Nigeria, Kenya, or the UK. During the course of the Congress, there will be presentations from those member organisations detailing what's happening in their countries, whether that be that they're undertaking with respect to professional practice or professional services. But what is happening across the globe is that health systems are recognising the accessibility of pharmacists, the capacity of pharmacists to do more, and the capacity of pharmacists to collaborate with other primary health providers in taking the load off medical practitioners. And that's certainly the case here in Australia, where we have had an increase in our vaccination scope. The vaccination process, or the program here for COVID, was struggling until they approved pharmacists to deliver COVID vaccines in their pharmacies. At that point, the vaccination rate across the communities increased dramatically. And that is just a very good example of how COVID facilitated an expansion of our scope of practice here. Having done that, pharmacy is quickly becoming, in Australia, the default solution and the default location for provision of all vaccination services. And that has accelerated very quickly. You mentioned about minor ailments. Certainly in Australia, we are moving towards having a formalised minor ailment scheme, so that if there is a UTI or a urinary tract infection trial on at the moment in all the states of Australia, where females in particular who are greatly inconvenienced by a UTI, there is a cascade of symptoms which can cause significant problems. And if you can't see a doctor for some quite simple antibiotics to fix it for a couple of weeks, you can end up hospitalised. Also about being absent from work and the like. So provision of those services will add greatly to the ability of pharmacists to be able to enter and participate in that primary healthcare marketplace. Especially with broad spectrum antibiotics. Correct. Although one of the big issues that FIP is dealing with in conjunction with the World Health Organization is antimicrobial resistance. That's one of the major topics that will be discussed at the Congress in Brisbane. And pharmacists have a very important role to play in managing the distribution of antibiotics, whether it's appropriate, whether it's inappropriate, whether a lesser antibiotic might be appropriate for a particular patient. So they're emerging roles for pharmacists, because we are, as medicine experts and the gatekeepers of medicines, we're quite often the last checkpoint before those medicines enter the community.
Can you comment on the interface? Because you've got little players, big players, you got everybody coming together. What's in it for the little guy?
What's in it for the little guy is all of that experience that the big guys have been through. And FIP is a melting pot of all of those experiences. We have established what's called the Global Pharmacy Observatory, which is our data bank or our reservoir of data, which is collected from all of our member organisations. So reports on programs that they're delivering within their pharmacy marketplace, developments there, they are then able to be shared with all of our member organisations, so that the experience of one marketplace can aid the development of the profession in other marketplaces. Simple things for those less developed markets. FIP developed what I call pictograms, because there's a large percentage of the world who can't read. And this is helping people when medicine can't be delivered in person. If medicine is delivered to remote villages, there's no point giving them a whole lot of printed information they can't read. So there were pictograms developed to assist people in getting the most out of their medicine. A simple thing, but in terms of delivering a far more positive outcome for the patient, that has had a tremendous impact. We can share experience. We can share development benchmarks with emerging marketplaces and member organisations, so that a lot of the hard work that's been done in other places can benefit the development of the pharmacy profession in those emerging countries, those poorer countries that don't have the resources. And their best practice may not look exactly like ours, but it will be significantly better than it may have been without the aid and assistance of those resources.
Paul, thank you very much for sharing all of this with Global Health Talks. You are a thought leader, and you are on the cusp now of being able to bring all of this together, not only at the Congress, but with this amazing organization and with the information you will draw in and share with the world. So I want to thank you on behalf of our show. I want to thank you on behalf of all of us, because pharmacists are very important people.
Thank you, Mike. I appreciate that.